Hey guys, how are you? If you are new on my YouTube channel, Health Insurance, then please subscribe my channel and share it with your friends. So basically in this video, I'm going to tell you about health insurance. So let's start our video. So here's here health insurance written in fact checked by the editor of Encyclopedia Britannica. So health insurance system for the financing of medical expenses by means of contributions or taxes paid into a common fund to pay for all or part of health services specified in an insurance policy or the law. The key element common to most health insurance plans are advance payment of premium or taxes, pooling of funds, and eligibility for benefits on the basis of contributors or contributions or employment. Insurance may apply to a limited or comprehensive range of medical services and may provide for full or partial payment of those of the cost of specific services. Benefits may consist of the right to certain medical services or reimbursement to the insured for specified medical costs. Some types of health insurance may also include income benefits for working time lost because of sickness, disability leave, or parental leave. So basically, it's a health insurance system that is organized and administered by an insurance company or other private agency with the provisions specified in a contract is known as private or a voluntary health insurance. So basically, here's it. I am now moving further here. So here's here, private health insurance is usually financed on a group basis, but most plans also provide for individual policies. Private group plans are usually financed by a group of employees whose payments may be subsidized by their employer, with the money going into a special fund. Insurance of hospital costs is the most prevalent form of private health insurance coverage. Another type is major medical expense protection which provide a protection against large medical costs but avoids the financial and administrative burdens involved in insuring small costs. Any system that is financed by legally mandated compulsory contributions or by taxes and whose provisions are specified by legal statute is known as a government insurance or social insurance. So here's it. This type of medical insurance plan dates from 1883 when the government of Germany initiated a plan based on contributions by employer and employees in particular industry. In the United States, Medicare and medical insurance for the elderly and the poor, respectively, are government insurance programs. The distinction between public and private programs is not always clear because some governments subsidizes private insurance programs. Quite different, however, are government medical care programs, which are sometimes characterized as socialized medicine in the United States. In this system, which are usually financed from general tax revenues. So here's here, basically, doctors are employed directly or indirectly by a government agency, and hospitals and other health facilities are owned or operated by the government. The National Health Services in the United Kingdom and the Veterans Health Administration Program operated by the U.S. Department of Veterans Affairs are examples of such a system. In the United States, Health Maintenance Organization (HMOs) became popular in the late 20th century as a way to control medical costs through the use of pre and negotiated fees for medical services and prescription medicines. An alternative to the HMO is a preferred provider organization (PPO), also known as the participating provider option, which offer features of traditional fee for service insurance plans, such as the ability to patients to choose their own health care providers, but also follow the lower cost strategies of HMOs. For example, those enrolled in a PPO can see any medical provider at any time without a referral from a primary care physician. However, if the insured uses one of the insurance company preferred providers, the company generally pay a higher percentage of the cost. In both HMO and PPOs, the insured is usually responsible for a certain portion of the cost of the medical services, with a co-payment fee paid by the insured at the time of an office visit being one of the most common charges. So here's it. Basically, here's it. Running uh, running the life insurance numbers, determining your coverage. Determining how much life insurance to purchase can be tricky. You need to figure out how much coverage you need, but you always also have to consider how much you can afford to pay in premiums. You can use formulas and calculators to help, but at the end of the day, there is no precise correct amount of insurance you should buy, no matter what an insurance agent tell you. So here's it. Generally speaking, there are two ways to determine how much life insurance you need. So basically, one approach is to take a multiple of your current and expected future income. The other focuses on your specific debts and your family's future financial obligations. Yet, life insurance coverage is based on a multiple of income. So yet, the basic of questions is if you were to die suddenly, what would it to take to replace your income? There is generally consensus within the insurance and financial planning community that you should purchase. So here coverage somewhere between 10 and 15 times your annual income. Some advisors may recommend multiplying your income by 20 or even 25. If your family has an annual income of dollar, I think 2 lakh or 20 lakh, 20 lakh and or 2 million dollars policy would meet the 10x income threshold. Basically, this is all about health insurance or life insurance. So, if you like my video, then please subscribe my video and share it with your friends. Thanks for watching this video.